The following portion of Daytime is sponsored by Peaks of Health.
Sometimes we can all use a boost of energy to get us through the day. And one way people are getting more vitamins and nutrients right now is through IV therapy. Here to tell us more about this wellness trend is Dr. Tracy Lenhart. She is Medical Director at Peaks of Health. Welcome, Doctor.
Well, thank you.
So just to kick us off, what exactly is nutritional IV therapy?
So a lot of times, we just don't get the nutrition out of our food like we used to. Everything's so depleted, it's ridiculous, like 90% plus depleted from what we used to get. And, I didn't think much of it until I started doing a master's in nutrition. And we're not taught this in medical school. So I did not realize that, for instance, magnesium runs 300 different functions in your body, and it's necessary for so many different things. So these are the cofactors that run everything. So when you're talking about energy, if you don't have enough of them, you're going to be tired. And so when we're taking vitamins and minerals, if we have a good gut, the maximum we absorb is about 30%.
So you're talking about if we just take a pill, we only absorb 30%?
And that's on a good digestive system.
Really?
On a bad one, it can be as low as 10%.
So how is it different with IV therapy?
100%.
100%?
100% of it goes into the system IV, as opposed to what we have to absorb through our digestive system and get into our body. So this is a way we can get higher doses in. For instance, I can do 2,000 milligrams of vitamin C a day. I can do 20,000 in an IV, all the way up to 50,000 if somebody needs it. So this is one of the reasons that I have all the energy in the world, because I get my IVs about every 10 days. But again, that's my schedule.
Right. So I was going to ask you, how does it work? So someone comes in, and where do you start?
Well, it really depends on what's going on. We do measure some of these nutrients to see if they're really deficient and they need them. A lot of times we may give them supplements, but if they're not getting what they need, or they're highly deficient, or again, like myself, my schedule's crazy. I also play competitive tennis, so I'm also exercising a lot. So I burn through a lot more nutrients than I can intake orally. So that's one of the reasons why I supplement through IVs. So a lot of people come in for nutritional IVs. Some of them come in for infectious IVs. We also do antibiotic IVs if somebody's acutely ill. Because being a board certified ER physician, I still practice that in my office sometimes for my patients to keep them out of the hospital. So we can do all kinds of IV therapy. We do some for cardiovascular disease, detoxifications, kidney disease. So we can actually treat multiple conditions with much higher doses through an IV.
How long does it take?
The average IV takes about 32 minutes to an hour, depending on what we're using. Like higher dose vitamin Cs that we use for cancer therapy, they can take a couple of hours.
And how often do you have to get them? And if you get them, do you decrease the number of times you come in as you go?
And it really depends on the person.
Okay.
So it depends on what we're treating as to how often they get them and how many they get. And it also depends on like somebody like myself who's continuously burning through everything. I get mine, as I said, every 10 days, but that's me because I'm just a high octane person, so to speak. So I want to keep this energy level up. But a lot of people, they can get one once a month.
Okay, so you tailor it to whatever the person needs.
Exactly, it's custom made. Everything we do is custom done for the patient. It's not individual care for that patient.
All right, Dr. Tracy Lenhart, thanks for joining us.
Well, thank you.
You're welcome. And if you'd like more information, you can visit peaksofhealth.com or call 727-826-0838. Daytime will be right back.
The preceding portion of Daytime was sponsored by Peaks of Health.